Hi everybody, my name is Joy Hodge, and in this video we're going over the bilateral hip and knee flexion, emphasizing on glute max range and pelvic control. The primary action is hip flexion in the sagittal plane. Now, we use this test to see how well the hip can go into flexion while the pelvis stays stable, which is very crucial for movements like deep squats and sit to stand patterns. Now, with this test and the two modified Thomas tests, you're going to need a table. The participant is going to lay in a supine position on a table with her tush hanging off of it. Then I'll cue them to bring both knees towards the chest at the same time, keeping the pelvis neutral and the lower back lightly on the table. Now, as soon as they bring their knees to their chest and when the hips flex, I'll be watching for when the sacrum starts to lift. That's the end of the true hip flexion before the pelvis rolls. Now, a normal range is if the knees can reach to the chest. Now, why does this matter? Well, having limited hip flexion or early pelvic motion can show glute tightness, posterior chain restriction, or core instability. For health, it can contribute to hip impingement or lower back pain. For performance, having a good pelvic control improves force transfer in lifting, squatting, and jumping. The key anchors are keeping the ASIS level, no lumbar rounding, and move symmetrically. This test is a qualitative test because we're looking for if the knees can go to the chest. Unfortunately, the participant's knees cannot go to the chest. In other words, there's some tightness in his glutes. Alrighty folks, that is the bilateral hip and knee flexion test, assessing the glute mobility and pelvic stability. See you next time.